Well, good evening, everyone. Thanks for your patience. We're just waiting a few participants to join us. For those who don't know me, nice to meet you. I'm Adriana Hochberg with the County Executive's Office. Hope everyone has had a lovely Tuesday. I got a chance to go on a brief walk before this meeting. It's a very beautiful day today. So thank you so much for joining us this evening. I'd like to transition to the chair of the Community Recovery Advisory Group, Mr. Elijah Wheeler, for remarks.
Adriana, thanks for that. I appreciate it. Good to see you all here this evening. Good to hear the birds chirping in the background. For those of you, birds or cicadas is the question. I'm starting to see some of those things emerge. I don't know about you all, and I'm a pretty big dude, but I'm afraid of those things. I don't like them. They scare me half to death. So the imagining that I guess billions of them are going to be burrowing out of the ground over the course of the next few weeks is frightening and makes my skin crawl. But I'm sure that for my dog and for the squirrels in the yard and for all those others who eat these things, that they'll be happy. But most importantly, that they'll be able to mate and do whatever it is that they do every 17 years. So good to see you all and talk a little cicada this evening, but more importantly, recovery from the pandemic. As you all know already, this is the CRAG, the Community Recovery Advisory Group, which consists of you all representatives from a spectrum of communities, populations, and issue areas here in the county that have been impacted by the pandemic. The purpose of this group is to advise the county executive and county council on the needs of the community in recovery and how the county can achieve a new normal that is more equitable than before or prior to the pandemic. I have the pleasure of serving as your chair here this evening, really looking forward to a rich conversation. Certainly you all received the agenda in advance. So we're going to go ahead and get started this evening while we're still waiting for others to connect. We're going to actually switch things up a little bit and start our conversation this evening by speaking to colleagues here from Montgomery County Public School System about their reopening and recovery as they head toward the fall. School is closing toward the end of this year, but as we look forward to the fall, we want to have a conversation with them and the Q&A around their plans for reopening and recovery. And with that said, I'm not quite sure who wants to go first from MCPS, but I'm going to throw it over to you, Peter. I'm looking at you at the top of my screen to introduce yourself. And then if you could go around and ask your colleagues to introduce themselves, and we can get started and go from there. Thanks for being here.
No problem. Thank you. So my name is Pete Cevadini. I am the Associate Superintendent for Technology and Innovation. And I will pass it on to Diane Morris next, because I see her next on the screen.
Hi, Diane Morris. I'm one of the 3 area associate superintendents. I supervise around 70 schools, elementary, middle, and high. And Mr. Wheeler, my Rhodesian Ridgeback, is having a feast on those cicadas. It's a whole experience here in Olney. We've got 1 million in the yard and he's finding them all.
I'll go next. I'm Nikki Hazel, Associate Superintendent of Curriculum and Instructional Programs. It's nice to be here, and I'll pass it to Kevin Lowndes.
Good evening. Great to see everyone. My name is Kevin Lowndes, and I'm the Associate Superintendent for Special Education. I'm going to turn it over to Janet Wilson. I see your name.
I think everyone's Janet Wilson.
So Dr. Wilson was stuck in traffic and she, I think, is logged on, but will be able to join closer to 7:30 in terms of participation. Dr. Wilson, if you can jump in, feel free. Otherwise, I've
And is there anyone else from Montgomery County Public Schools? Because we all came on as Janet Wilson when we logged on.
Right. So Nikki, I'll go ahead and introduce myself. My name is Nicole Elaine. And that's probably, I just realized that I came on as Jen. That is not Janet Wilson. It's actually me. I'm sorry. My apologies. My name is Nicole Elaine. I'm one of the executive directors to the Deputy Superintendent, Dr. Monifa McKnight, and I'll be listening in. Thank you.
Great. Well, we appreciate you all being present with us this evening. We can play the game later with a real Dr. Wilson. Please stand up. But for the time being, if there are opening remarks that anyone from the staff of MCPS would like to engage us in, I want to give you that opportunity to do that now before we start getting into any discussion around you all's reopening and recovery plans.
Nikki, did you want to start and I'll go next? And then I think it was Pete and then Diane.
Do you want us to show our PowerPoint slide, Kevin? Is that what you're referring to?
I don't know. If we can just talk about the talking points we had in the
Sure,
PowerPoint.
I can talk. That's fine. So again, I'm Nikki Hazel, Associate Superintendent of Curriculum and Instructional Programs, and just going to share a little bit with you about the recovery that we have taking place from curriculum and programs. Many of you may have heard in our school district, we have what is called a 2.5-year plan. Really, Dr. McKnight and Dr. Smith leading the effort around the next 2.5 years. How do we begin to move students back into school buildings and ensure that we are addressing any unlearned content, any learning loss that students may be experiencing, and also address social emotional needs. And one of the committees under the 2.5-year plan is a committee called Mitigation of Learning Disruptions. And that committee includes staff members in central office, school-based staff members, and community members. And we have 3 focus areas that we're working on at this time as we look at the summer and moving into the fall. One area is around summer school, and particularly around how we engage our community around summer school and ensure that our students are being registered. And we have really done a huge outreach effort. We are really excited that in 2 weeks, we have over 20,000 students who've registered for summer school. 11,000 of those students are registered for in-person summer school. And so we are working with our communications team to get the word out. We have door knocking campaigns taking place. We have a bus campaign taking place. We're trying to help our families register online. It could be a little challenging for some of our families to do so. So we have our counselors involved, and then at some point we're going to move to a paper-based registration to make sure that we're not missing anyone. Then we're also going to do in-person registration if families want to come to certain locations at central office and other locations. We'll help them get registered. And so we've been looking at our data, inviting certain students to come, but open to all. And again, it's available in person, and then the same experience available to students who choose to do it virtually. And so we're really excited about the opportunity. We're also focused on professional learning this summer to ensure that our teachers are prepared not only for how to address some of the learning disruptions, but also that emotional, social emotional well-being component. And so that is big. And then finally, tutoring. We've done a lot of research around how we get back some of that learning, and the research is saying that high dosage tutoring is really going to be critical. We already have tutoring taking place in MCPS, and we are going to expand that to provide more for our students before, during, and after school. And we are also looking at some external vendors to assist us with providing tutoring services for students, so that we can make sure we're covering all content areas, all grade levels at times that are convenient for our families. And so those are the 3 major areas that we'll focus on. So I'm going to stop and pass it on to the Pete. Okay.
To expand on what Ms. Hazel was talking about, we are also looking in the fall to start a virtual academy. So one thing we have learned in this whole pandemic is that there are some students who do learn better in the virtual environment. Many students, or most students, want to return to school, but we have found that some students do better, whether it's for health reasons or learning reasons, etc. So we are beginning a virtual academy in the fall for kindergartners all the way through to 12th grade. But our focus is to try and get students back in school. However, for those students who either cannot go back to school for health reasons or learn better and would prefer a virtual learning environment, we are starting this program in the fall. More information you'll be hearing about in the coming month or so on that program, but things like credit recovery, grade improvement, additional courses that are needed for students at the high school level are all parts of this virtual academy. We are also looking at how we can provide an admissions program, so how students can apply to this, and also how we can work on underserved communities and make sure that they're aware and can select this program if need be. So you'll hear about more of that as we go through. Who's the next person? Ms. Morris or Mr. Lowndes? Mr. Lowndes?
I'll do it, Pete. I can
Thank
talk a
you.
little bit about special education in what we have in store. So we understand that many of our students that receive special education services had a difficult time during the distance learning format. And as a result, we are obligated to provide compensatory recovery services. These are services that are based on the student's goals. Each student that receives special education services has goals identified for them to work on. And the goals might be an academic goal, they might be a speech goal, they might be a social emotional goal. But whatever those goals are, it's up to the school system to provide the services to help those students make progress towards their goals. And so there'll be a discussion with every family whose student receives special education services to talk about the progress that those students made during the distance learning format, with an understanding that many of our students had a difficult time making progress towards their goal. And then there will be an individual plan made with the parents, with the students, and with the case manager at the school to talk about how to catch these students up. These services will be provided above and beyond the regular class day. And so the parents will talk to their case manager about, can these services be provided after school? Can they be provided on the weekend? Or can they be provided at another time that's available for, with the students available for these services? And so that there'll be plenty of phone calls taking place between now and then the end of September with families, with students that receive special education services, to talk about the services that they missed during the pandemic and how we can help them get caught up. Diane?
Sure. So as we talk about recovery for the fall, as you all know, first we want to start off actually by saying we so value our partnership with DHHS, with Dr. Stoddard and Dr. Gales. We could not have gotten through this without you all. So thank you for everyone on this call who serves as an advisor. But when we talk about fall recovery and our plan, a lot has evolved in the last week in terms of updates from the CDC. We know that there's further updates that are planned to come out this week that pertain particularly to schools. And so right now we're just watching it really closely to be able to determine what fall reopening will look like exactly. Starting July 12th, we have our 2 innovative school year calendars that begin their school year. There are year-round schools, Nix and Arcola. And for them, they are going 5 days in person. We've spent some time with class configuration to ensure that we're meeting the needs of the students. But right now, we're holding to wait for what the new CDC guidelines and information are like. So more to come once we get that report, hopefully this week, that really guides how are masks being worn, what is the physical distancing that is required, is it required? So those are the pieces that we're waiting on in terms of guidance to develop our.
Thanks, Diane. I know you, okay, so you just answered my question. So we're going to promote Dr. Wilson to a panelist so that she can come off of mute.
Thank you very much. I appreciate that. I wanted to reiterate what Diane indicated, and that is that, you know, the school district is very, very grateful for the partnership that we've had throughout this, we refer to as our continuity of learning phase, early March, April, May, June last year, and then into the recovery of ed. And we could not have done it without you. I think the team here, I think the overarching message is that we have to recognize that there are still going to be some students who may have circumstances where they cannot or do not want to come back into school. And the virtual academy will serve well, I think, in that transition. But as Diane indicated, for the majority of our students, the goal is to return to brick and mortar in a normal fashion. And so we're all anxiously waiting what we believe will be a new release of school guidance from the CDC, unless it came out today and I'm unaware. But we're understanding that additional information will be coming out. And we know that you may have read in this coming out calling for a return to normalcy among both superintendent ranks and association ranks. And so we look forward to that. And with that, we'll be happy to take any questions that you might have.
Thanks, Dr. Wilson. We appreciate that. Folks, before we get into any Q&A with MCPS, I do want to acknowledge that Dr. Pollard, Montgomery County's outgoing president, such a huge loss to us here in Montgomery County, has joined us this evening. So Dr. Pollard, welcome. Good to see you. Good to have you. I want to turn it over to you for some remarks before we get into any kind of Q&A session here.
Well, thank you so much, Mr. Chair, and thank you for that warm greeting. Always a pleasure to be before the community. Let me say that this has been an incredibly busy month for lots of different reasons, and certainly the type of feedback that this community receives from this particular advisory group, I think, is particularly important. So I'm delighted to be here. I'll offer just a few comments because I know typically when someone wants to talk about education and reopening, my friends at MCPS end up taking up most of the questions. And as someone who is a parent of a child in MCPS, I just really appreciate all the work you all have done. I don't think you have been lifted up enough in terms of what you have done, serving one of the largest school systems in this country, and more importantly, doing it with a community with high expectations, and also at the same time doing it in an environment that none of us would have anticipated. So just congratulations to you all, what you have done. I'm very happy to talk about reopening because I do find it an odd term for us, because at Montgomery College, we've been open the entire time, just as everyone else has. We are certainly preparing excuse me, to think about returning back to facilities for learning and working. But this has been something that we know our structured remote programming has done well. It's allowed us to provide educational opportunities for our students, while at the same time, it helps us to think a lot about how we are evolving. As my colleagues at MCPS indicated just in their comments a moment ago, there'll be some parts of things that we learned as a result of the pandemic that we will not be abandoning. And this idea of going back is something I think a lot of us have to start to reject the notion of. This is not going to be the same system of education that we've had, just as our economy is not going to be the same, our healthcare system isn't the same, our social services safety net is not going to be the same, and dare I say, our conversations about equity will not be the same. So I'm going to share with you a couple of the guiding principles we've used at Montgomery College, and then share with you a few of the areas where we still have some pain points we're working on. Health and safety has been our guiding principle as it relates to our work at Montgomery College. We know the impacts of COVID have been unmistakable, and we should have to continue to grapple with that means in our society right now, particularly as we look at, even with the numbers going down, we still have unvaccinated folks in our communities, and we know that there's also a possibility of variants. So we spend a lot of time at the college thinking about how we can be very thoughtful and outreach to both our students and our employees, because we don't get to privilege one or the other per se. We're also thinking deliberately about how we reach out to communities who are rightfully wary of what one might think about in terms of a public health system that in a lot of ways has not been designed to meet their needs. And as a result of that, have been very reluctant to think about vaccinations. In large parts, those are some of the students that we serve, even some of my employees as well. So we're thinking deliberately about how we continue to keep the standards up about health and safety, by also recognizing and honoring the lived experiences that may suggest that something is somewhat problematic in that space. I'll also say with you that we're using our federal and state recovery dollars to look at how we can help diminish any of the environmental issues that might allow the COVID-19 virus to propagate within the organization. Our air filtration, thinking about wayfinding, how we route people through the organization, signage, and so much more. As we even elevate health and safety as our number one guiding principle, our second one has been around access and equity. So we've learned a lot of hard lessons, I think, as a globe and as a community, as it relates to access and equity. We heard some of our colleagues talk about that. Not all of our students had computers at home or internet service. I'll even say that not all of my employees had that at home. So we had to spend a lot of time overnight thinking about how we can connect both students and employees to the work that we do. And we did this to the best of our ability by providing grants for computers and internet service. We spent a lot of time thinking about how we could get information to people, such as the new county that's providing grant dollars on the new emergency broadband benefit. I think that's great, but we've got to be thinking about this long-term. Emergency and just in time has to be translated into systems that allow us to exist even when this emergency moment no longer exists. And we also know, as my colleagues at MCPS already mentioned, we're facing equity issues around learning. Some of our most vulnerable students are certainly the ones who are that we have to be very intentional about how we make sure that we're meeting their needs, and also at the same time providing them access to the resources they need within our organization. For instance, our WDCE program, which is a largely grant-based program that works with basic needs in our community. Those folks who are trying to secure high school equivalency, those who are learning English. Grant guidelines primarily have a lot of those programs being face-to-face. So we've had to struggle about how we begin to deal with those areas, but we're working on that. But we're celebrating, thirdly, student success. That's been our third guiding principle here. We know for us that on Friday, as our commencement, we have about 3,000 students graduating with associate's degrees, certificates, or diplomas. And we're so grateful for that, because we know that the route to recovery for any community is going to be through its community colleges, because we don't have the luxury of making sure that anyone is left behind. Everyone has to be a part of the solution for the recovery. So we did that by listening to our students. And I really want to thank our faculty who really helped elevate the issues of our students. They thought very deliberately about virtual tutoring, remote coaching, and some really extraordinary student life programming that connected students more intentionally to the institution. And right now, we're still grappling with a few issues as it relates to the transition back to an in-person working and learning environment. If vaccines are required, might they discourage students who we really don't want to not see disappear from our ranks, that we know that we need to be there for them? As an institution that prides itself on equity and inclusion, this is a tough call, and our faculty and our staff and our board is going to be really kind of grappling with this issue over time, but we're very much committed to it. Currently, we're planning to offer both in-person and remote classes, with the majority of our classes still being done in a remote format, but we're going to be increasing the face-to-face more as our numbers continue to go down in terms of COVID cases, but also as vaccination increases, and also going back to health and safety, that our facilities are ready to be able to respond to the needs. We've been able to really operate on some equity-based decisions. We were able to provide over $800,000 in grants to students at the beginning of the pandemic. We've been hosting equity hubs in combination with MCPS and the Black and Brown Coalition. We've communicated about every county resource. And I'm going to tell y'all, if anybody doesn't know it, we are very fortunate to live in Montgomery County, where there has been an abundance of intentional interaction with the community to provide services and supports in those spaces. I communicate to our college community 3 times a week, and every time I always include things that the county is providing. We've hosted a biotech boot camp for displaced workers. We have another one coming up. This is again trying to recognize that building the workforce of tomorrow, doing that in close partnership with business and industry, is going to be essential for us to really begin to recover as a community. In partnership with the county executive, we're working closely to locate a college presence in the East County, which we know is an area where we want to close skills gap, upskill residents, and generally expand access to post-secondary education. We know that people want to be educated in all parts of the community, and our job is to make sure that no one is left behind, no one is seen expendable, and that we're doing our work as an institution. Finally, I'll say that we've had to answer a lot of hard questions over the last 14 months. I'm very pleased with some of the equity-based work we're seeing come out of policy decisions from the current administration in the White House. We are very excited about the fact that we'll be able to provide federal relief dollars to DACA and Dreamer students, as well as our international students. And I'm very grateful to live in a community that sees its community college as an asset, whether it be our mass vaccination site that we've done in cooperation with the county, the state, and Holy Cross Health, whether or not is that we're able to tap into the community to help support our students. It has been a pleasure to be a part of this community and to serve it. And has been noted, I am making a departure, but I guarantee you that I will always be a fan of Montgomery County and will continue to follow the work that's done here because it is something that's truly remarkable. With that, Mr. Chair, I hope that was within a good time frame, and I'll pause and respond to any questions that are necessary.
I appreciate that, Dr. Pollard, and certainly please continue to check the chat as we shower you with your well-deserved kudos.
Oh, I didn't have the chat open. Oh,
The chat's open. No trolls here. So we want to make sure that we are showering you with your well-deserved kudos for all the great work that you've done here in Montgomery County for the community, not just for the students of MC, my son having been one of those. Make sure that you save an extra room for me. I'm going to come visit you to get rid of or get away from the cicadas here. I don't believe they're out in Nevada.
no, I'm with you on that one because those things, I saw one land on my car the other day and I almost had an accident. So I feel your pain. I feel you.
Perfect. So thank you for spending some time this evening. We know how busy you are. Folks, I'm going to ask you to do a couple of things. If you have a question, feel free to go into the chat and enter your question. I'll try to get to those there, or go to the Q&A section if you don't want to ask it, or simply raise your hand. As I scan the screen, as you all know, I do on a regular basis, I will point you out and ask for you to ask your question. And we'll make sure we'll do this as orderly as possible because I'm quite sure there are a ton of questions this evening. With that being said, John, I'm going to start with you. I see you have your hand up. Go ahead with your question.
Thanks so much, Elijah. So I have a couple questions. One is, they're two related to two separate issues. One is to vaccinations. And I'm curious about if MCPS has been willing to work with DHS on trying to get vaccination clinics at schools. I know of two high school principals, one at Blair, one at Northwood, who on another community meeting really expressed the desire to have a vaccination clinic at their school. And they talked about the fact that that will be a great way to have students get vaccinated. That's my vaccination question. My second question is on technology. Obviously, and Dr. Pollard, you mentioning giving out computers reminded me of this. You've given out lots of technology to students. Essentially, MCPS is probably almost a one-to-one district right now in the amount of technology that's been given out. Is the plan moving forward that students are going to maintain and keep those computers for the long haul and that we will essentially become a one-to-one district? Or what is the plan around the technology that's been given out to students over the past year?
Sure. Do you want me to answer I'll answer the technology questions first. Is that okay? So our plan is to keep the one-to-one technology, so students will be able to keep their devices, for example, over the summer, and keep them as long as they need to until we either give them a new one, right? So after a certain amount of time, they'll become obsolete and we'll give them a new one, or move to a different model. The idea is that unless a student has avoidable damage. So if a student breaks the screen or something like that, unless something like that happens, the student will keep it for free indefinitely until a new one is provided. So if the student moves from 5th to 6th grade to another school, the student can bring the device with them. The only time that we would want the device back is if a student leaves us and goes somewhere else, right? Or graduates. So that's the idea behind that. So at some point they'll become obsolete though, and we'll have to replace them with new devices. So there is a 4-year plan to do that. I don't have a crystal ball to view what's going to happen in 4 years, but our plan is to do that in 4 years.
Thanks so much.
You're welcome.
Hi, this is Christy Daphnis. Just to follow.
Sorry, before that, did somebody have a response about the vaccination question?
I'll take a shot at it.
Sure.
Hey, John, how are you?
Hey, Earl.
So we've been meeting with MCPS to talk about this, and actually there's going to be a clinic at Argyle tomorrow. So we are doing clinics at schools. The issue was that there was no way we're going to be able to do clinics at all the schools at the same time. And so many parents expressed that they wanted to get the vaccine as quickly as possible. So it's going to be a tricky balance of doing them in schools while also recognizing that many people were going to want to get it before it was going to get to the school opportunities. And so we're still going to have more school opportunities. We're actually doing Stone Ridge because we have to do public and private. We can't pick and choose. And so we're doing Stone Ridge reached out. They were one of the few private schools that offered up their site for, doing it, and then Argyle as well. And it's not just for the schools. So they're actually bringing people in from other elementary and other locations proximal to Argyle. And we're going to do more clinics like that moving forward. We're actually working with Matt Lieber from the Soccerplex as well to do some of the soccer program, because that's another thing. The other thing we also were concerned about is obviously with it being a 2-dose regimen for Pfizer and there being a 3-week period in between, we have a very narrow window when schools are still in session to get both doses done. And so the school-based program was one of those things where we had a very narrow window to do it, and most people wanted it the first week. We've already done 10,000 12 to 15-year-olds as a county entity, let alone what's been the pharmacies. So it was sort of like, we're going to keep doing them at schools, but so many people were going to get it the first week through other opportunities that we couldn't just do it at every school. So it's sort of a balance of those two.
Is there a process? If a school is interested, do they reach out to you? Is there a process in place? Because like I said, for the past 2 or 3 weeks, both the principals at Blair and Northwood were very interested in having something at the schools.
Yeah, so we can work through the administration. So if they want to let up the chain know, because obviously we meet with Dr. McKnight and several from her team on a weekly basis. And so certainly if they just want to share up the chain that they want to host a clinic, it shouldn't be a problem to have them geographically spread across the county with schools that are interested in doing it. So no, that's not a problem.
Awesome. Thanks so much.
Great, thanks. Christy, I think you had a follow-up to John.
Yeah, just to follow up on the technology. I definitely appreciate the goal to have one-for-one technology. I do think that you need to look at the policies around like how long they need to be kept and the damage issue. I know a lot of parents who've brought Chromebooks in for repair, and they've been told they're going to get charged for it. And it's questionable about whether it's misuse or just use in general. I mean, you get an old Chromebook that's assigned to you from the school, and it's not like there are things that don't happen over the course of regular use. So that's the first part of that. Second, it is absolutely ridiculous that parents need to go over to Rockville, not accessible by public transportation or barely accessible, between the hours of 9 and 3 or 9 and 4, Monday through Thursday. You need to be able to get some of the repair services and other distribution out into the schools. It's absolutely an issue from a parent perspective.
I do hear what you're saying. The reason why we had them go to Rockville before was because the schools were not open. Now that schools are open, though, I do want to assure you that they can go to the school with the device, and it may take a little longer. It doesn't go on the spot because the schools don't have replacement devices on the spot, but they can return the device to the school to get repaired. As far as the repair issue, we are replacing any older Chromebook that we gave out with newer ones. For example, high school students received older Chromebooks because we didn't get enough new ones in time. And those have since come in, and we are replacing them, of course, free of charge to those high school students who have the older Chromebooks. And you are right, on those older Chromebooks, wear versus avoidable damage, there's a line there, right? So a screen doesn't break by wear, but some parts of it do break by avoidable by wear if they're older devices, and we are working to fix that. We do have a very specific menu and information on what constitutes avoidable damage. For example, broken screens or missing keys, things like that are considered avoidable damage. And we are working to better communicate to our parent communities and to our students as well on what those differences are. But I do want to assure you, if you bring the device to the school now, we can repair or replace them through the school. The difference is it may take a little bit longer because if you go to 15 West Goody, where our repair center is, you can get a replacement device on the spot, right? So because those devices are there, our repair people are there, etc. If you are at Argyle, for example, it may take a day where we could bring the device to the school to replace or repair that device at the school, but we don't have anybody maybe on site who could do it on the spot for you.
Thank you for that.
You're welcome.
Laura, you had your hand up. I want to go to you.
Yes, thank you. Actually, I'm part of the Black and Brown Coalition, and we just had a meeting today. So I figured I'd pick a question that they brought up. And that was about all the tutoring services that are being sought. They want to make sure that we are operationalizing all of our community services in the nonprofit sector to make sure that we're building on those relationships. And I know that we have school coordinators coming in next year. They're supposed to implement this community school model, but I really feel like that needs, and maybe it exists, I just haven't seen it, a policy around that school community model to make sure you're actually bringing everyone in that community into the school and seeing how they could help provide these services, because they really understand their community. So anyway, I just wanted to bring that into the discussion. Thanks.
Thank you, and I appreciate that. I know we've had some conversations with Identity and some others who have really asked to be a part of the tutoring initiative and for us to train their staff, but certainly we will keep this in mind and touch base a little bit more. Thank you.
Great, thanks.
Thanks, Laura. Elizabeth, did you want to ask your question that was in the chat?
Yeah, so what I'm curious about, and this really applies to all of us, the Montgomery County, the schools, Montgomery College, we have a large infusion of money coming into the county, and it has the potential to really be game changing if we use it strategically. So what I'm wondering is if there are some conversations taking place between, like school, county, Montgomery College leaders and others to kind of identify collectively, what are some of the bigger gaps and opportunities that we have to really tackle some of our greater needs. It's like a 4-year amount of money.
I'm happy to have a conversation about that, at least from the Montgomery College perspective. One of the things I think, and I appreciate your conversation, because one of the things I said at the college very early on is that we should not be seeing this money as a way of saying, okay, let's go out and get our big wish list out and do whatever it is we want to be able to do. The reality about this, and the hard reality that all of us have to grapple this is one-time money. So when you make this investment, we can't continue, or you should not, at least my directive at the college, as long as I'm there, has been not to use these resources to then do special programming that we will not have the ability to forward fund in future years or have a commitment around that. But what we should be using this money for very deliberately are things that are already pressing problems that would not necessarily be able to be addressed by our county or state investment. So for instance, as I mentioned earlier, the whole issue of health and safety, air filtration, HVAC, and all the capital projects that are important, we're going to be using a significant infusion of our dollars to go in and do that type of work. This is work that had already been on lists that we have with the county and the state. They simply don't have the capacity to assume that. So if there are ways in which we can do this, let's sit down and figure out how to do that. So we actually have our internal team. Actually, I'm sitting on my desk right now, a 14-point plan that we're planning to use our dollars with, that really look at and kind of amplifying the point that you made, Elizabeth, in some very key areas, things that allow us to remove barriers, centralize today's student in terms of operational reform, stop thinking about the students we wish we had, the ones we used to have, the ones we think we have, and start really addressing the students that we have right now. We're flattening decision making, and part of that means enhancement around technologies. So a lot of, as was talked about earlier, if we need to replace certain types of things, let's get those things done to the extent we can. Digitization is going to be really important. We learned that as a part of this. Many of our institutions would have collapsed had we not been able to have already started some work around digitization. And now we're going to have to amplify that. We are also going to be spending quite a bit of time in terms of our outreach to communities that we may have been underserving. So we're going to be moving to the extent we can, now that we have the clearance from the DOE, to provide federal support dollars to our DACA, Dreamer students, to international students, as well as expanding our presence in the East County and doing a lot of work to make our online programs more robust. While enrollment in higher education has been contracting nationally, the areas where we are continuing to see growth are in online programs, because adults' lives, I can't speak for my colleagues at MCPS, but adults' lives are more complex. So they are working, they're taking care of children, multi-generational. Oftentimes, when you lack an appropriate public transportation infrastructure, the reality is they're trying to get on a bus and go across the community to get someplace just simply isn't sustainable. So our Board of Trustees has been looking at this issue of the nature of work as well. We've been doing and studying that for about 2 years. We're going to systematically redesign our workforce around skills and competencies that are needed. So as a matter of fact, our board at our next meeting, I believe, is going to be endorsing this plan, because we just simply did not want to do exactly what you said. Come in here and say, oh, here's this, $40 million. Let's go ahead and figure out what we want to do with it now. That's not sustainable. It's not good business sense. So that's where we are at Montgomery College. And I suspect a good portion of that ideology or framework is probably informing MCPS, but I'll be quiet so they can say their own response.
That was awesome. That's exactly what I was curious about. And I'll just add a quick comment that I was talking to the Dallas Resilience Officer today about one of the things they're planning to do, because they recognize that technology is important, but also digital literacy is lacking in a lot of households. So they're going to try to add digital literacy to an ongoing program that they have on workforce training.
That's excellent. Thank you for sharing that.
Thank you for that question, Elizabeth. Tiffany, you asked a question in the chat. Did you want to ask that live?
Yes, my name is Tiffany Jones. I am a family child care provider. I'm also the coordinator for a new initiative called The Basics, and a mom of 3. But my question is there any thought to outreach to early childhood educators, like family child care providers and center-based providers, where we reach our earliest learners so that they are better prepared to enter both Head Start, pre-K, and kindergarten?
Well, I can speak to that if you want. I have no problem. I tell you that Montgomery College, as you may or may not know, Ms. Jones has an exceptional ECE program that we're doing direct work with a lot of child care providers. In fact, one of the things that our college learned fairly quickly is that we didn't have to worry about that particular program, because they had already been delivering a significant portion of their curriculum already in an online environment. They had built the support structures, doing it in the non-traditional spaces. So we're continuing to do specific work with this right now. And as a matter of fact, a commencement, I just saw our faculty member who's leading that program announce we had a significant jump in the number of credentials we're offering in that space, both in terms of short-term certificates and also degrees, associate degrees, and the fact that many of those were being done and bilingually. So I feel that we've done some really good work in this space. We have some state grants that's allowed us to expand capacity. So I think for us, we have been very deliberate in this space. And I know we have several advisory groups at the college to do this and are part of some state movement in this space. But if you want, I can, the person at Montgomery College who can talk more, as we see ourselves as helping to provide the next generation and also the current generation of ECE folks, is Sonia Hernandez. And she is Dr. Sonia Hernandez, and she is phenomenal. And she will be very happy to speak with you and talk about our program.
Yes, I am a proud graduate of Montgomery College, and I'm connected with Dr. Hernandez on the Basics Initiative in Gaithersburg.
All right, let me be quiet then. So I'm done. Thank you.
I was also going to add that Barbara Andrews, who works for the county, but also does a lot of work in the ECE space, has been participating in the education mission area work groups as well, because obviously we view, much like you've already described, that the early child care is a part of the education continuum, and it's a big part of the county executive has been very interested in building out those programs. So I think obviously it'd be great to have, I think we haven't had Barbara come talk in some time, and I think she would be a wonderful addition to a future conversation with us. But obviously that's been an important part for the county as well, to be really engaged in the space with Montgomery College and MCPS, and frankly the private schools as well. So they are meeting on a regular basis, and obviously I don't think anyone is here from the ECE side of the county, but certainly we could have them come.
Thank you, Earl. Appreciate that. Peter, you had your hand up.
Yeah, I was trying to type in the chat, but I can't. I'm all fat fingers. So anyway, first of all, I'd like to thank Dr. Pollard. Dr. Pollard, you've done a great job. Like the idea of trying to put a educational facility here in East County. I know we've had discussions on this before, but I'd like the fact that there is movement in this area, and I wish you all the luck, all the best of luck in your new ventures out in Nevada. I believe it's Nevada. But my question is to Dr. Stoddard. Dr. Stoddard, you have a wealth of information based on zip code areas of where all of the high-risk areas as far as COVID infection goes. In regards to school vaccinations, why don't we start in schools in that area and address those areas first, and then migrate to the low-risk zip code areas? I think that's a solution right there. It's self-evident, and you don't have to have schools elbowing each other out to become the first one. This is a methodology. It's based on risk, and it's a simple solution. That's it. Thank you much.
Thank you, Peter. Appreciate that comment. Laura, you had placed something else in the chat. Do you want to address that?
I'm sorry, I have like a million things.
Yes. Oh.
But I was just, since Dr. Pollard brought up how she's using money for HVAC, I figured I'd ask MCPS, how much money are we using for the federal emergency funds on HVAC? Because of course it's directly related to COVID, but also it's been an issue for many, many years, because as you know, whenever we're trying to scrape around for money, we tend to have to reduce some of what we're spending on our maintenance. So this is such a great opportunity. I really hope we have a pretty significant plan, and maybe none of the people here are the right people to ask, but I just wanted to put that out into the universe. Thanks.
So Laura, thank you for your question, and you are right. We don't have the right people on the call here to answer that question, but I do know that certainly under the ESSER funding, that is one of the allowable ways to be able to utilize the money. And there are plans with regard to that, but we would not want to venture to say at this point on this call. But certainly that is in our scope of what we're considering.
I did not see it specifically in this 112 million, but it was very large line items. So I will follow up. If you don't mind, I might copy you. So
That's perfectly fine. And Essie McGuire would be your contact. I'm sure you know
Yes.
that. So yeah.
yes, thanks.
Thank you. Pivoting a little bit to the recent violence in the Middle East, Samira, I want to hand it over to you for the question that you posed in the chat for MCPS around students and some of that conversation.
Oh, thank you very much, Mr. Wheeler. Good evening, everyone. We see headlines, news, TV, social media, and that concerns me because it brings me back. I was born and raised in Palestine, so I have families in every city and every town there is right now. What kind of training, what kind of instructions that the teachers or the staff have to answer questions in case do we give the students a chance to talk about it? Are we covering any of this part here? When my kids were in school, I approached the social studies, and then we came up with the Middle East curriculum, and I'm very proud to be one of the founders of that curriculum. But I think it's got dissolved, and it's not really Middle East anything. I'm really worried. We cannot ignore this anymore. Social media is not the proper place for our kids to get their instructions and their knowledge. And I also like to know what, I am a family service worker with the pre-K Head Start, and we are always, trained and told to be sensitive for backgrounds of the families, especially right now, everybody have their own cultural style. So what kind of training do we offer in MCPS to teachers or staff, especially and social workers, especially if they have to go and do home visits? And this is very difficult situation for everyone. And also one other thing I said is, does the World of Difference program still exist in MCPS? Thank you.
Thank you. I think that's a great question. I will look into the World of Difference program. I have not heard of that, so that is something that I can look into to find out if we still have. But anytime we have current events that are taking place around the world, particularly that can be very challenging and controversial, we do work with our staff. We, particularly if there's information out there, we do provide our teachers with information that they may share with the students. That's factual. We're very clear about not taking a position. And we often give our teachers questions that they may ask, or sentence starters, open-ended types of questions if they want to engage in dialogue with students, but are very clear about not taking positions. And we've been having conversations with our teachers about that for the last several months, actually, all through the pandemic. As you can imagine, all of the different things that have been happening in our country and across in the world. We've really been talking with our, particularly our social studies teachers and our teacher leaders and principals at the elementary level about how we handle challenging topics with students. It's important to have the discussions, but we want to make sure that we are doing it in a way that doesn't take a position, and that we are respectful of the opinions of those students in the classroom. But I will look into the course that you mentioned.
Thank you. We have partnership with Georgetown University, the Arab Contemporary Studies, and this is our 4th year. We do training. They provide the speaker, the material. When we were in person, they also provided full course meal to all the attendees, and every teacher gets a certificate and at least 2 books. And this is the kind of partnership we're looking for. I would like to be part of this. I mean, I have 4 children in the schools. I was very involved because my family was affected even here with hate crimes during the Gulf War. And it just continued for many, many years throughout my children' school life. And that's what really, I don't know, motivated me. I know this is the wrong word, maybe, pushed me to be involved and just say, the kids are not learning anything. They just watch TV and listen to what their parents are saying at home. We need to make changes. We need to, our world is changing. We're not like 30 and 40 years ago. We rank in the top in the nation in diversity. So we really had to take advantage of that and use. We have a lot of resources in Washington, D.C. in this area. Thank you.
Thank you, Samira. I think it's really important to contextualize the conversation, knowing that our young people are coming back to school buildings this fall with a collective set of traumas, racialized violence, the pandemic, as well as the violence that's taking place currently in the Middle East, such as you pointed out, Samira. So I appreciate that question. Peter, you had your hand up. I don't know if that was previously up or if you raised it again. I wanted to check with you. Okay. It might have been up from before. John, I see you have your hand up. Okay.
Yeah, thanks so much. I wanted to follow up a little bit on what Laura mentioned about the tutoring programs and wanted to see if there was any thought at all. And so I guess, Nikki, to you, about either using peer-to-peer tutoring and or students, sorry about the dogs, peer-to-peer tutoring, clearly they like tutoring, peer-to-peer tutoring, or even a partnership with Montgomery College of having older students working with either high school students or younger students. That's a way to, could be cost effective and also just build more of that community.
Yes, and I think that gets back into the question that I believe it was Laura who asked about working with community. So certainly we will take that back to our mitigation committee, and certainly they have an interest in keeping the tutors local as opposed to hiring external partners. So when I say external, I don't mean the community. I mean, we have, for example, TutorMe is a company that we are using right now. And so they would prefer to keep our tutoring services within the school or outside immediate community. So I will take that back to our mitigation team and really talk through how we can engage more of our members. Thank you.
Thanks.
Okay, I want to go around the screen and make sure that I'm not missing any raised hands. Melanie, you just came on the screen, so I'm wondering if you have a question at all. Dee, go ahead.
No, I'm too late to the party, sorry.
Oh, no worries. No worries. Do we have any more questions this evening for our guests, Dr. Pollard, Dr. Wilson, her team? Brother Ricks, I saw you come on. Go ahead.
Yeah, I just want to say that maybe we can do something to make it so that Dr. Pollard won't be able to leave Montgomery College. And
I assume we did that already, yes.
Yeah, I mean, she's really been great, and it's just been a blessing to Montgomery that she has been here with us. So I'm sure that in whatever endeavor she has, I know it will go great. And maybe we can build a college bigger than Nevada, and she'll come back. But we love her.
Thank you so much. You're so kind. Brother Ricks, as you have been just a wonderful inspiration, and all of you. I would tell you I'm not going to a better place. I'm going to a different place. Montgomery County is truly exceptional, and it's because of people like you and living in a community that lives its values out loud. I can tell you for a fact, this type of forum does not exist in every community. So I am better for having been here and just grateful for the opportunity. And I'll also say that touched me as well. Just many of you know that while I was there interviewing, my father passed, and many of you know my father was raised my sister and I alone after my mother died, and I was very young. So there is one of the things he told me there right before I talked to him a few days before the interview. He just said, "Baby, you got to do what you got to do." And that's what this particular point it came to me for this. But I guarantee you, I will be back in Montgomery County frequently. I have friends and family that I will have here for life. So thank you for that. And this is not about me, so I'm going to be quiet and get ready to leave. Thank you all.
Do what you got to do. Do it. Just do it.
Can I take advantage of Dr. Pollard still being here today?
Sure, please. Sure.
I just had a conversation with my son. I hope you guys can hear me. He's at University of Maryland in material science, and he looked for internship, which he finally got, yay. But I was talking to him about the diversity of his faculty, and he said what's really great is that they've done a great job getting more women in positions. And there are several leaders in the department that are women, but other diversity, not so much. So there's not many African-American or Black professors. And I know we have the talent right here in this county, and I'm kind of motivated. So if I could hear about any programs or anything that we could help push through, MCPS, we have all this money coming in, tutors, we could have a STEM-based tutoring program that would go up to Montgomery College and feed into University of Maryland. Would just be amazing. So
the only thing I'll offer to you is that Montgomery College has the largest transfer engineering program in the country. We have about 1,200 students enrolled in that program, and it is gloriously diverse, just as Montgomery College is. I'll also tell you that the diversity that your son is probably seeing at University of Maryland, many of them are transfer students who come from Montgomery College because we bring the color and the diversity to their program, because otherwise they would not necessarily have that there. So I think the idea of diversifying the faculty is significant. And one of the things that any institution, just as MCPS is doing in its work with Montgomery College, let's keep our talent local. So we know that Montgomery College, 70% of my students are students of color. We know that they're in large parts interested in science and STEM programming. Let's think about ways in which we incentivize these students to not only benefit from the rich investments this community makes in K-12 education, and then continue their higher education locally and come back to us locally. And I think we're going to see more of that. Grow your own talent is essential. In this particular, federal dollars doesn't necessarily provide an opportunity for that directly. Maybe you can plant some seeds, but I think if a community really believes that it wants to live its values out loud, then it figures out how to do that. So I appreciate that, and thank you for raising the question, and we'll be happy to connect folks in Montgomery. Well, we're already doing it with MCPS. So that's one of the things that this community is so fortunate. They don't even know how tightly coupled we are with each other. So it's a beautiful thing.
thanks.
Thank you, Dr. Pollard. Do we have any more questions this evening for our guest? Going once, going twice. Okay. Well, Dr. Pollard, thank you so much for your work again. Certainly you deserve your flowers while you're here to receive them. You will be missed. I'm checking Southwest as we speak to see when I can get out there. I'm gonna come visit, get away from these cicadas. I'm telling you that right now. They landed a gem in you. You've been a tireless community advocate. Thank you for everything that you've done on behalf of this county. We will give you back some time this evening to spend with your family and relax. Be well. We wish you the best of luck.
Grandson is going to Montgomery College this fall. He just is graduating in the class of 2021 from Blake High School. So maybe we'll send him. Maybe we'll send him on. I'll send him on out to Nevada.
There you go. Montgomery College to Nevada State. There you go. Thank you all. Take care.
Thank you, Dr. Pollard. To Dr. Wilson and your team at MCPS, we want to thank you for joining us this evening and answering the questions. We wish you all good luck. Certainly, if this group can be of any support to you all as you transition not only into summer, but certainly this fall, we look forward to making sure that we can be supportive in any kind of way. Thank you for your hard work and dedication throughout the course of this pandemic. We know it has not been easy for teachers and for school systems in dealing with this. I am excited. I am the proud parent of an MCPS graduate, and I have an incoming kindergartner. So I'm really looking forward to, that's called the college savings plan. That's about the only way you can pay for college these days. So we are really looking forward to our daughter starting kindergarten this fall. But thank you all for joining us this evening, and we really look forward to hearing more from you. Melanie, did you have something before we?
Do you see that when there's a question in the chat that maybe we can answer? I don't know. Are there any plans in having clinical social workers in schools?
Perfect. Thank you for catching that, Melanie. So the question in the chat was whether or not there are any plans for clinical social workers in schools considering the trauma and suffering children are experiencing.
We do have some clinical social workers in schools with our special education programs that work with our emotional disabilities students. And those programs also, the social workers that are affiliated with those programs in the schools do go out and work with all the other students within that school. And so we have about 20 social workers currently working with our students with emotional disabilities, and we're looking to bring some more.
Perfect.
I was also going to add, this is one of those things where sometimes they say enough to be dangerous, meaning you know a little bit about a little bit. And I do know, I mean, this is not a surprise to anyone. There's a lot of ongoing conversations about the role of the school resource officers, and there are a lot of potential alternative models for how that is done being proposed and discussed both by the county executive, the county council, MCPS, the Board of Education. And so one of the potential areas of discussion is around the use of clinical social workers as a add-on or a substitute for the SRO program. And so there's nothing more to talk about there yet. We're not there yet, but I think there's a lot of conversations. There's a work group, multiple work groups that are looking at this issue, and we don't have anything to talk about in terms of an announcement yet. But I do think that is something that's being actively considered as part of those work group discussions as we think about what the future of what was formerly the SRO programs and how you still do that close work with students in schools. And so I know that there are potential, I think the county has expressed, certainly the county executive has expressed some interest in this area and funding this area with the work of the council, but I think they're deferring to these work groups to come to a more cohesive solution before making a decision about what's going to happen.
Thank you for that, Earl, and you are correct. I feel more than comfortable as the co-chair of one of those work groups to tell you that it is indeed one of the directions that we are going in with the conversation around placing social workers in school versus having law enforcement present there. So thank you for that question. Appreciate that. If there's nothing else for the MCPS team, we're going to give them a few minutes back this evening as well, too. To enjoy the evening, maybe go for a stroll or something like that. Once again, if there's anything that this group can do to support you all as you are supporting our young people, please do not hesitate to let us know. Thank you for joining us here this evening.
Thank you. It was a pleasure. It was a pleasure to be here. Thank you for the invite.
Thank you. Take care, everyone. Okay, folks. So now we're going to turn over to Earl for the next part of the agenda. We're going to talk about the future of this group of the CRAG. Earl.
Yeah, so good evening, everyone. Sorry I was a little bit late to the meeting. Yeah, so what we've discussed is, and I think John and others raised this last time, this was not meant to be a for perpetuity consideration, but we know the recovery is going to go on. So what we'd like to propose is to make this into like a quarterly meeting and have it be a little more focused on issues that you all are interested in. Particularly, we figure, take the summer mostly off, have this be our last meeting for a few months. No one who is on the group is committed to having to come back, but we'd certainly, if you're if you want to conclude your service, just let us know, and we can, we had some alternative people who were not selected ultimately for the first time round that we can include in the group, and you should not feel bad. We very much appreciate you all having been here engaged and asking questions and pushing us on issues. But we figure if we make it quarterly, we know the recovery from COVID-19 is going to take some more time, but obviously your time is valuable. And I think that if we made it a quarterly meeting, we could focus on key issues and have it be that way. The thing that really put us over the top on that suggestion is our chair has so graciously agreed to extend his service as the chair so long as we moved into a quarterly schedule. So I owe him several cases of beer at this point. So we're gonna, so I'm gonna that's all that tab is gonna come due soon enough, and I'll
I'm gonna share that around with everybody. Just delivery with
Yeah, we can talk about. I know our new alcohol beverage service director, Kathy Durbin, is very interested. As she says, it's 5 o'clock somewhere all the time, and so we can have a.
Hey Earl, I'm sorry, my dog's going crazy again.
Okay.
I think that's a great plan. One thing though, I know I would appreciate is that if there are ways that members of, sorry, I'm going to close this door. If there are ways or activities or things that are happening within the county that members of this group you think could be useful in participating in, if there's a way you can use the CRAG list to get out that information. Many of us are involved in lots of different things, but I think that all of us are here because we're dedicated to do things in service. And so if there's a way to use that list, and I see Melanie's hand raised.
I'm already regretting raising his hand, but I'm regretting it already. But what about a Craig monthly newsletter?
I think we could probably do that. I mean, to be candid with you, we develop bi-weekly reports on recovery, and so we could certainly transform those into a monthly newsletter. That wouldn't be that hard to lift for us to talk about some of the key highlights of things that are happening, and particularly changes that are happening with our recovery framework and how we're, there are at least 2 new.
I'd love that
to
be like a really easy shareable
sure.
newsletter where we can be like, here, tweet this clinic out, tweet this thing out, blah, blah, blah,
Is that the person who's in publicity willing to help with that, Melanie?
So Earl, who do I talk to
get a monthly newsletter?
I can take it on. I just need help.
Okay, so I'll probably say
I hate myself.
I'm going to volunteer Brian Miller, who's on the call. He's my deputy recovery manager, to follow up with you, and let's talk about, because we like I said, we have these reports. They're fairly lengthy. We just need to. I think it was.
You just need to complicify them. Yeah.
It's Thomas. I think it was Thomas Jefferson said, or I forget who it was, who said, sorry, I didn't have time to write you a short letter, so I wrote you a long one, essentially, because so it's really have to take everything and just try and squeeze it down to the digestible and relevant points. I think that would be great.
Melanie, I just put in the chat, since I volunteered you, I'm volunteering myself as well. I'm willing to help out in any way possible.
So yeah, no, I think that would be great, because I do think there are going to be increasingly more opportunities. Like, with the way the reopening has proceeded, there's going to be a lot more recovery related work over the future weeks. I didn't realize this was going to be a quote in the Washington Post when I said it, but I think I said, the end of the pandemic is really we stopped the bleeding, but we've got a lot of trauma to recover from. Education being one example, but also, obviously mental health across the board. We've got a lot to deal with. I think, our recovery work is going to continue for, months, more likely potentially years in some areas. And so I think definitely just keeping a way to keep people apprised of the way things are progressing, even if we're not meeting regularly, because I think it'll be a good way for you all, because you may identify things you want to be more involved in, not just in terms of meeting, but getting involved in from a county perspective as they go forward. And so I certainly think that's a good idea. Like we hold other events like mental health forums and trainings for our food providers that I think would be well placed for you all to help us get out there more into the public or participate yourselves in if that was something you'd be interested in. So I think it's a good idea. And I'm looking, Ryan, I think Ryan will connect, so we're good. Yeah, I think that's our plan. So if you're not interested in continuing your service with the CRAG, when I say this, you all have been phenomenal. We very much appreciate your feedback. So there will be no, we'll be sad to see you go, but we'll be happy that you participated. And I think that's what it comes down to. So if you just let us know, hey, I'm interested in, I'm not, I'm interested in doing other things. So I'm going to discontinue with the CRAG. That's fine. We can certainly add on some additional individuals moving forward to get some fresh perspectives in. So just no worries. If you just let us know, that's not a problem. But I think that's what we'd like to do to continue if that works for everyone. There's some still things going on. I think we're planning for this. Don't recall whether we're going to have a June meeting or not. Do we have a conclusion on that? Maybe Elijah can remind me if we decide or not. But I think more likely what we'll do is just, take a hiatus for a couple months and come back in August, perhaps right before, obviously school will be coming back in then, and things will be, I think it's a good time for it to happen. So. Okay.
Sounds great.
Perfect. Well, let me say this before we take a break. Obviously, Dr. Stoddard, we thank you. We know how hard and tough and long you've worked over the course of this past year or so on addressing the needs here of residents in Montgomery County as we try to move toward recovery. And to be honest, folks, setting a new normal in place, because normal was not necessarily good for all of us, right? So we're really looking to move toward a more equitable future here. So I think it's really important that folks take some time to take a break and rejuvenate as well too. You can't pour from an empty cup. So we appreciate your work, Earl, Adriana, Ben, Tina, of course, and Ryan, for everything that you've done to pull this group together. I appreciate coming here in this space with you all and having some really rich conversation here as we have over the course of the past year or so. Look forward to getting back together with you in August. Laura, to your question, I think we did say probably early August sometime so that we could talk about school reopening. We'll probably send out a date soon for feedback, but did you want to ask anything about that?
No, that's awesome. I just want to kind of put a point in there because, parents are a little worried about what's going to happen. So anything that we can help share earlier is a little better. Thanks.
Certainly. Folks, we're going to let you go. You get back some time this evening. We had a great conversation. Go out for a stroll. Beware of the cicadas. I saw somebody in the chat saying something about humans eating cicadas. I don't want to be friends with humans who eat cicadas. I am vegan. That means I cannot even eat bugs. So I don't want to know what that tastes like remotely. So enjoy eating cicadas or doing whatever you do with them. I'm going to go hide from them. Folks, have a great summer. Find some time to rest and rejuvenate, take a little vacation, but most importantly, be well, stay safe, and we will see you all in August.
And Jerome, you take care of that incoming kindergartner.
Will do.
Thank you.
Okay, thank you, everybody.
Bye.
Thanks, everyone.
Bye-bye.